Hello, it's Brad Trivers here, your progressive conservative candidate for District 18, Rustico Emerald. And wow, it's been quite the last 4 or 5 weeks worth of campaigning, knocking door to door. One more day left of going out and meeting you, the constituents, and finding out what your issues and concerns are. And today in my my video blog, I just wanted to talk about healthcare. And I mean, everyone knows that it's an issue, and very specifically, it's about doctor shortages, and it's about wait times. Those are the key things. And of course, whether or not people can actually afford the drugs that they need, especially seniors and people on low incomes and fixed incomes. Now, how do we solve these problems? I don't think it's all about money. Definitely, if we prioritize our spending and spend our money on healthcare instead of some of the other things we don't need, that will help. But it's also about making sure that we empower the people who know what the problems are and have most of the solutions to communicate those up to senior bureaucrats so that the right decisions can be made about how to implement our healthcare services. And when you're talking about wait times and retaining doctors, those are the sort of issues that require that sort of organization. Right now, we have a situation where the Liberal policy really is the health minister is supposed to set policy and health PEI implements it, and never the twain shall meet. I was in a debate about a week and a half ago with CBC. I was representing the PCs. We were debating health online. The Minister of Health did not show up. They sent another MLA, and she stated very specifically, the Minister of Health sets policy, health PEI implements, and it's not the role of the Minister of Health to be involved in implementation. Well, I strongly disagree. And here's an example from a former healthcare administrator that I met while out canvassing. And she said, in the past, ministers of health have gone in and called up a hospital the day ahead of time and said, I'm coming in tomorrow, get me a room, and spread the word that I'm going to be there because I would like to talk with any healthcare professional, whether that be an RCW or an LPN or a nurse or a doctor or whatever, that wants to come in, a receptionist, tell me what their specific problems are and what solutions they think should be in place. And then that health minister, who had educated themselves so they could talk intelligently with the healthcare workers, would go back to the senior bureaucrats and say, look, I'm looking at where the rubber meets the road, and this is what is happening with your staff. And I want to know what you're doing to address these concerns. That's accountability. That's what a Minister of Health should be doing. And in fact, that's the sort of thing we need to see throughout our government. At any rate, that's just another example where communication can mean so much and make such a difference. Well, the election's only 2 days away, and I feel that I could be a very strong voice here for District 18. I've got a great chance to meet a lot of people, at least half the people I think in the district I've seen personally. Feel free to contact me at any time, but hopefully on Monday you'll support me, and I would dearly love to be your next MLA. Thank you very much.